Hi, my name is Kristen Harris, and I'm going to be discussing the effects of exercise and physical activity on the diabetic. Diabetes for me is something that's very close to my heart. My father has had type 1 diabetes for the last 48 years, and so growing up it was a huge part of my everyday life. I witnessed him giving himself injections, I witnessed him experiencing extreme bouts of hypoglycemia, extreme low blood sugars, and even transplants and going to the hospital for different things. So for me, it's something that I want to learn more about in my collegiate years, and so I'm going to be discussing that today. So what is diabetes? Well, diabetes is a group of metabolic diseases characterized by high levels of glucose in the blood. There are two types of diabetes. Type 1, which is the one that my dad has, is characterized by the inability of the body to produce insulin. So 10% of all cases are type 1, and these individuals have to take insulin through either, like I said, an injection or a pump. The other type is type 2. These individuals, it's 90% of the rest of the diabetic population, and they can control their diabetes through oral medications, insulin in some cases, dependent upon how severe it is, but through diet and exercise as well. So what happens when diabetes isn't controlled or when it's unable to be controlled? Well, these individuals experience a lot of nerve damage. Nerve damage can occur in the eyes, so they experience maybe glaucoma or diabetic retinopathy, and eventual blindness if it gets bad enough. The kidneys, there can be kidney failure, renal failure. For my dad, he did experience that, and he had to have a kidney transplant about 17 years ago. There's also serious nerve damage that can occur in the fingers, the hands, the limbs, the legs. When that nerve damage occurs in the legs, this neuropathy is experienced through, they just have no feeling in their feet. So if they walk, they have to take extreme care of, their feet, and if they walk out in some place where there's a nail, they could step on it, they won't feel it, and then a wound is formed, and it leaves them open to infection of all different kinds, which can eventually lead to amputation. So how do we prevent or intervene on these serious cases of diabetes, or how do we reduce the effects or reduce the probability of this? Well, exercise, especially for the type 2 diabetic, plays a huge role in reducing the effects on the body. So through resistance training as well as through endurance training, like walking or jogging, the body is able to increase its sensitivity to glucose. So it's more able to take it up and use it as a source of fuel during the exercise. There was actually this study published in the Journal of Applied Physiology where 9 middle-aged participants all exercised at 75% of their VO2 peak, and they did this for 5 consecutive days. They took a 7-day break, so 7 consecutive days of inactivity, complete inactivity. And during that time, the testers took their blood glucose during their active times as well as during the periods of inactivity. Well, they recorded the blood glucose from the last day of activity, and then they compared that to days 1 and 3 of the following week of inactivity. On those days, on day 1, there was I believe it was a 43% increase in blood glucose. So even on day 1 day of inactivity, the increase in blood glucose was 43%. On day 3, it was a 66% increase. So right there it shows that, the more active we are, whether it's, taking a walk or spending 45 minutes, cleaning the house, the more active these individuals are, the more sensitive they will become to the glucose. So they'll be able to take it up, reducing their risks of, developing all of these nerve issues, as well as, just in general being able to control their diabetes. So what we need to do is intervene and get these people moving preferably every day, but if not, 30 minutes of moderate activity, walking, cleaning, most days of the week, or at least 3 days of the week. If we can do this, we can help these individuals, take control of their life and take control of their diabetes. Thank you.